Hello, my name is Igor Belyansky. I'm Chief of General Surgery at Anne Arundel Medical Center and Director of Abdominal Reconstruction Program at AMC. I'm also Director of Fellowship for Abdominal Reconstruction Program. My focus is repair of hernias. Really, my whole practice, 100% of my practice is dedicated to repair of hernias, complex hernias, as well as issues related to previous hernia repairs. I grew up in a family of a physician. My grandmother was a physician. She practiced in the middle of the 20th century. It was always interesting to hear stories about her experience with patients. I always had healthy respect for the profession and kind of was interested in maybe becoming a physician in my teenage years, but was not sure. It felt like a very daunting task of actually going through all the schooling and training that was associated with it. In my 20s, it really crystallized that this is a field for me. I decided to become a surgeon because several things. I loved the fact that with my hands I can really impact or influence somebody's life and change it for the better. Here we are dealing with sentinel events in each patient's life, and we spend 2 to 4 hours per patient taking care of them. But the reward is so great, seeing the patient come back feeling better, just based on something that I've done with my own 2 hands. And I really always enjoyed working with my hands. The important part about patient-provider relationship is trust. That's the most important thing. And it's sometimes very challenging to establish that trust in very limited time that you have. Where, I try my best never to rush with the patient and really spend enough time answering questions, explaining the procedure to the people who are going to be going through this, again, this whole experience. My hope is in this very short time of anywhere from 20 minutes to 45 minutes to an hour, I'm able to explain everything to them and actually build that relationship of trust. My philosophy of care is to treat people like I would want to be treated, to treat people like they're my family. Again, honesty and trust. Those are essential foundation of a good patient and doctor relationship. The reason I get out of bed every day is I truly consider myself privileged and lucky to do just professionally what I do. I was lucky to find something that I truly have a passion for, working with my hands and truly feeling like I'm making a difference in other different people's lives on a daily basis. That's a big privilege.